So let's do some basics about lazy eye. People talk about it that, hey doc, I got a lazy eye, I always had a lazy eye, and things like that. So I wanted to discuss it here so that it's easy for you to digest that what is an eye that's a lazy eye, or what's a lazy eye. Okay, so let's go over it. What's the definition? Well, what do you say that, and when do you say that there is a lazy eye? It's basically, in technical terms, it's called amblyopia. Okay, it's a vision development disorder where the eye, usually it's one eye, it fails to achieve the normal visual development or the normal visual acuity. And even with the prescription glasses or contact lenses, you don't have the perfect 20/20 visual acuity. That's what we mean by a lazy eye or amblyopia when we are talking about it. It typically develops from the birth up to age of 7. That's the cutoff. That's the developmental frame or the developmental timing where this thing can literally hit a child. And it's the leading cause of decreased vision amongst the children. So it's very important to be addressed. Okay, what's the prevalence? How often do you see it? It's up to 5% children in the world, they get lazy eye, and in America up to 3% of the kids get a lazy eye. So if I am checking a kid in United States of America, my chance of seeing a lazy eye in a kid is up to 3%. So 3 out of 100 kids that I see, they have a lazy eye. It depends. Some days I see more lazy eye, some days I don't see. Some weeks passed and I don't see any lazy eye. So 3% makes sense to me. What are the signs and the symptoms for a lazy eye? Number one and very common thing is, and very known thing about lazy eye is a wandering eye. The eye is either in or out. It just wanders here and there. And the patients, they just come to me and the parents are telling me that, doc, his eye is not sticking in a point. It's lazy. It's wandering here. What's going on with that? Then I check it and then I find out that, okay, amblyopia and strabismic amblyopia is what's going on. And another problem is they get a poor depth perception. The depth of vision goes down and down and down with the time. The squinting and shutting of one eye is also a behavior that many kids exhibit, and they are trying to focus better. They are trying to avoid the blurriness. That's why they are trying to do that. And they also try to tilt the head. They try to tilt the head one way or the other just to focus, just to accommodate that wandering eye or the lazy eye or the blurry eye. And another problem is sometimes without any of those symptoms, the kids are just diagnosed at a school in a screening test or at a nurse practitioner exam or a pediatric exam that, hey doc, I found out this vision in this eye is not 20/20, so we need to see whether there is a lazy eye or not. I really thankful I am to those pediatrician teachers, whoever finds it out, because the earlier you find it out, the better, because the better is the prognosis of the treatment. What are the most common causes? There are 3 main common causes for that. Number one is the muscle imbalance. That's why it wanders. One eye wander, tuk tuk tuk. So you have to treat it. And second biggest problem is the sharpness in the vision. The refractive error difference between the 2 eyes is the second most common cause of a lazy eye. We call it as refractive amblyopia. The wandering eye, we call it as strabismic amblyopia. The third most common is deprivational amblyopia. In that case, sometimes one eye is not clear. So if an eye is not clear, it leads to a deprivation amblyopia. For example, some kids, they are born or they have congenital cataracts. Some kids have other corneal problems or opacities. Anything that blocks the light from getting into the eye is depriving that eye to develop normally compared to a good eye. Okay, what's the treatment? How do you treat it? Early diagnosis is the most important part of the treatment. Then biggest treatment is glasses or contacts. The best correction to see better is very important. Another treatment after that is vision therapy. The best vision therapy, the best starting vision therapy is patching. and you patch the good eye. You always patch the good eye to force the bad eye or the lazy eye to wake up and see better. Another thing is, if the kids are not compliant with the patching, we do some blurring drops. For example, atropine, it dilates the pupil and it makes the blurry, so we blur the good eye in that case so that the bad eye is literally forced to work. It's basically a chemical form of patching. The patching is a physical form. If a kid doesn't let you patch the eye, you just dilate the eye and make it blurry. That's a kind of patching, okay? That's the kind of eye drops we try for that. Surgery is another thing. In some cases, the surgery is needed, but not every kid needs the surgery. So don't be scared of it, okay? Here are some references that you can go over for more details, or ask me in the comment section. If you have any questions, please ask me in the comment section. I do go over in a lot of details in the answers when I answer the questions, and I like to respond on the YouTube messaging because the TikTok does not let me type too long of an answer. Okay, thank you so much. Have a great day. Bye bye.